Hi, I'm Nazir Shahnaz from Shahnaz Interiors Neighborhood. We are IT consultants and design and build contractors for hospitals both private and government in Malaysia. So today's topic is about inclusive design for all. Inclusive design is not aspirational, it's fundamental. The place that we create should reflect the many voices that we meet on daily basis. This is especially so true for essential services that our community expect and needs, such as healthcare. So how do we design in order to make every group feel inclusive? The idea is simple: to give them options. There are 8 principles of universal design. However, before I touch on that point, why do we even talk about universal design when our topic is inclusive design? The concept is universal design is the basic of understanding human behavior, especially in hospital settings. However, inclusive design is about fulfilling all users' requirements. So let's go back to the basic. The 8 universal principles are: number 1, comfortable. Is the actions such as reaching for handrails within the body functions. Number 2, body fit. Does our design consider different body abilities and sizes? Number 3, wellness. Is our design promoting health and also preventing from harm and dangers? Number 4, social integrations. Does all group feel respected? Number 5, understanding. If there's something that needs to be operated, is the function clearly understood? Number 6, personalization. Is there any room for personal choice or options? Cultural appropriateness. Does our design cater to the uniqueness of different culture around the world? Number 8, awareness. Is our signage design easy to see? Of course, each group has its own socio-political characteristics and cultures, but they all share the same common goals at heart, which are: number 1, comfortable; number 2, dignified; number 3, equitable access to all places and spaces within a hospital. Where patients' well-being is the heart of its priority, should be the best place to actually start implementing the goal of inclusive design. Demographic variations require different design approaches. For example, at waiting area, there should be a suitable chair for children matching to their heights, chair for pregnant mothers, and sturdy chair with armrest for elderly. Of course, there's no possible magic formula to it, but the Center of Architecture and Built Environment, CAPE, pointed out that inclusive design is not about meeting every individual needs, however, to offer them options so that we can accommodate to different groups. The sheer diversity of population makes the task of including everybody almost impossible. However, the best solution to inclusive design is to actually get to know your users, understand their requirements, and consult them on how best to meet their requirements. Around the world, people born with disabilities or even living with disabilities are increasing around the world, and it is reported between 3 to 10%. Because of this, accommodating to medical conditions and physical disabilities are the very essence of hospital settings, which include accessible circulations and amenities, which are already incorporated in law and also added into building guideline standards. There are other conditions that are also increasing in terms of its priority. For example, bariatric patients, patient bed and also room. Number 2 is demographic variation, whereby equipment and also furniture to meet the requirement for children and also elderly. And number 3 is mobility. tactile indicator for vision impaired patients. Environmental factors such as view, art, light, acoustics are well researched and proven. However, these factors may not benefit uniformly. For example, high-level lightings may benefit to reduce medical errors. However, it may cause discomfort to patients with eye conditions. Where a space is negatively affecting client or patients, we as a designer must be able to provide options. For example, quiet waiting area or private patient spaces, dimming the lights, closing the blinds and such, so that at least we can help to alleviate the physical and emotional discomfort that they felt. More recently, researchers are beginning to explore the effects of environmental factors on neurological conditions and also other invisible conditions such as autism and also dyslexia, which are given so much importance nowadays because public are aware and getting diagnosis on daily basis. In the recent statistics in 2022, 10% of Australians are diagnosed with autism. So because of these numbers, it is important that we consider these factors when we're designing for hospital. For example, when we are designing for pediatric ward or patient wards or even emergency department. Why emergency department? Because it is the place with highest traffic, highest visual, lots of noise and too much of visual clutter. Because of this, patients, especially small children, will not be able to withstand being held at emergency department. Because of this, they might cause a certain disturbance to other patients or visitors nearby. So, as a solution for patients with autism, perhaps we can have a separate area for them to have a very quiet place with acoustic panelings and also dim lighting and distraction items such as toys. The next topic would be something quite sensitive. It is gender and sexuality. It is sensitive because it is often coupled with faith and culture practices around the world. In most hospitals, it is considered normal or a practice to have gender-based amenities or facilities, for example, toilets. But the trends are moving in Australia where they are going towards gender-neutral toilets. And in the recent Australian building standards, they are also including tactile indicators for disabilities. So now they would have gender neutral toilets that is able to also cater for other disabilities. Breastfeeding room in some countries are considered unsafe because one thing, it is often poorly maintained, and number two is sometimes it is located at a long corridor away from passive surveillance of others. In addition to that, they also feel uncomfortable to share the room with other women's husband. So as a designer, we must be able to offer segregations in the room, a planning whereby we will have a waiting area for fathers and breastfeeding areas for mothers. Issue of faith often cross over with cultural practices and also rituals, which is often related to spaces for prayers. Globally, Muslim represent substantial portions of the society, and Muslim faith influence decision making, use of healthcare practices, and family dynamics. One studies also suggested that cultural competency between Muslims requires elements such as gender concordant care, halal food, and neutral prayer spaces. Accommodating to different faith may require something more specific. For example, stained window for chapels, or more general such as prayer areas with generous window or even indoor and outdoor spaces for large families. Other ethnic groups may have their own requirements, which can be identified through consulting with them or local knowledge. Cultural competency training can offer as a solution so that we can transform the culture of care, so individual, religious, cultural characteristics can be genuinely accommodated and cared for. Inclusive design is a cost efficient and it's not a burden. It is often helpful to benefit more people than those initially designed for. Apart from convenience and moral imperative, inclusive design that excludes users are now legal and financial liabilities. There's this landmark case that happened in Australia at Hospital South Coast University Hospital, whereby judge ruled in favor of vision impaired patients who felt discriminated by the design at that hospital, and the judge ruled out that the hospital must rectify their designs to number one, signage to include braille and also contrast color fonts, and then number two is to use lower glare for tiles, and then number three is to have tactile indicators so that patient can independently access to all spaces within the hospital. And all this resulted in renovation work of additional Australian dollars of 5 million. As a conclusion, a great design should be reflected on how well it accommodated to inclusive design. It doesn't mean that all individual needs are being met exactly, but it is about accommodating to all different requirements of the group. It can be achieved through including diverse groups, understanding their different requirements during the design processes while maintaining high design standards, so that we can design something to embrace everybody on an equal terms. Thank you so much for watching. I'm Nazrin Shahnaz from Shahnaz Interior Cinema Berhad.